Hello and welcome to today's COVID-19 update for Friday, October 29, 2021.
We have completed that process, so we have piped oxygen going to every bed on the second floor, and we had started about a week and a half ago on the third floor, so that's about completed as well. So the entire hospital now, of close to 195 or so beds, to each bed we now have piped oxygen. Right now, in terms of, in addition to those types of works, we have completed operating theater at the Ocean View Hospital because on occasion we do have women who are coming in pregnant and we'll need to do emergency cesarean sections, and that's why we have installed a theater at the Ocean View Hospital to cater for those emergencies, because in instances the mothers are too sick to be moved to the Georgetown Hospital, and therefore we really have to do an emergency operation sometimes. In addition to that, on the outside of the building, we've started construction of a base so that when the oxygen plant comes into Guyana, that we'll have the suitable base on which it can be installed. So these are basically the works that have been ongoing at the facility. We have built out a capacity there of about 195 beds, as I've said. That's a total bed capacity. We have in the ICU, we have been expanding that ICU so we can comfortably accommodate about 50 patients, ICU type patients. And the other wards are there for people who would have the less severe form of COVID, but nevertheless, they require hospitalization. Currently, we do have, I would say, excess capacity because our cases at the hospital have come down quite a bit. Right now, we have 41 patients at the hospital, and we have 17 persons in the ICU. That is coming down from when we would have on average 38 patients in the ICU and probably about 120 patients in the hospital itself. So that's a significant difference. In terms of the COVID-19 vaccination numbers, first dose adult, we are now at 381,013 persons. That's 74.3% of our adult population receiving a first dose. For second dose, we are now at 242,327 persons. That's approximately 47.2% of our adult population. And with the Pfizer vaccine that we've been giving to children between 12 to 17, we now have administered 27,276 doses, first dose, and for the second dose, 18,058. So that's 37.4% coverage for first dose and 24.8% coverage for second dose. If we break down vaccination by age category, so let's break that down 60 and above because they're more at risk We have been able to get about 77.5% of that population to get their first dose vaccines. And for second dose, that population is at 63.5%. So what we need to do is bring both of these numbers up closer to about 85%. And if we are able to do that, we will start seeing that the death rates, hospitalization rates in this age category would drop significantly. We have to continue working because if we don't, many other areas in Guyana would get closer to herd immunity, and then within our country, we'll have areas that would be endemic for COVID. So those areas, of course, because it would be higher risk if you travel to those areas, you can get COVID. So that's something that we'll have to watch, and we have to keep encouraging the leadership in these areas to make sure that they get vaccinated. I'm hopeful that with the new set of resources that we're getting through USAID, part of which will be used to increase our educational coverage pertaining to vaccine, that with some of this new funding that when we use it in some of these areas, maybe we'll get some more people coming out.
You have been watching the COVID-19 update for today, Friday, October 29, 2021. I'm Natasha Smith-Thomas. Goodbye.